Welcome to the Culture of Healthcare, Nursing Care Processes. This is Lecture C. The component, the Culture of Healthcare, addresses job expectations in healthcare settings. It discusses how care is organized within a practice setting, privacy laws, and professional and ethical issues encountered in the workplace. The objectives for nursing care processes are to learn what nurses do and how they are trained. Learn how nurses make clinical decisions and assess patients. Learn about the settings where nurses work. Learn about the procedures nurses perform. This lecture, Nursing Routines and Procedures, describes the many different places where nurses work. It also explains the invasive procedures that nurses perform. The word invasive means that the procedure involves going inside the patient's body with a needle, tube, device, or scope. This lecture also explains how nurses administer medication and document procedures, and it describes the technology that nurses commonly use. Nurses provide a wide range of services to patients and their families in many different settings. This slide and the following slides describe where many nurses work and what they do there. Acute care nurses treat patients who need immediate treatment or monitoring. Depending on their qualifications, acute care nurses might screen, diagnose, or treat patients in an emergency room, an urgent care clinic, or at a surgical clinic. Acute care nurses manage a wide range of patient injuries and illnesses. These nurses also care for patients who are recovering from surgery or an invasive procedure at independent surgical centers and hospital surgical departments. Acute care nurses care for patients whose problems are not life-threatening. Critical care nurses, on the other hand, care for patients with life-threatening problems, often in hospital settings, such as intensive care units. Ambulatory care nurses care for patients with non-urgent problems, usually over multiple visits. They treat and educate patients about a wide range of medical problems with the goal of improving the patient's health long-term. Many ambulatory care nurses also use telecommunications tools to provide long-distance care, monitoring, and medical advice. Because they focus on health promotion, many ambulatory care nurses work in public health settings, occupational health settings, or community health clinics. Ambulatory care nurses also work in doctor's offices, diagnostic centers, and in the military. Long-term care nurses work with patients who need substantial ongoing care for a chronic illness or disability. They often provide this care in assisted living facilities or nursing homes. Long-term care nurses might help patients with daily activities, such as getting dressed, or help manage a patient's medical problems, such as by giving medication. They also handle emergency situations. They must follow the regulatory requirements by the facility where they work. Long-term care nurses often get to know their patients well as they care for them. These nurses take care of each patient's medical needs, but also consider the patient's non-medical needs, such as their social needs. Home healthcare nurses provide care in a patient's home. They might provide short-term care over days or weeks, such as helping a patient recover from an injury after being released from the hospital. Or they might provide long-term care for a patient with a serious chronic illness or disability who can live at home. A home healthcare nurse monitors and evaluates the patient regularly. Like long-term care nurses, home healthcare nurses often get to know their patients well. Many home healthcare nurses work for a private or nonprofit nursing agency, such as the Visiting Nurse Association. These agencies send nurses to the home at the request of a healthcare provider, patient, or patient's family. Home healthcare nurses are sometimes called visiting nurses. Visiting nurses. Like ambulatory care nurses, public health nurses focus on health promotion. The difference is that public health nurses look at the health of an entire community or population. They look at how community health is affected by cultural, economic, and other forces, and they help create public policies to make the community healthier. An example would be working to pass a statewide law against smoking in restaurants. Public health nurses might also help assess how effective a healthcare system is. Some public health nurses are employed by clinics or health maintenance organizations where they work with individual patients and their families to help them learn about community health needs. Other public health nurses work for state government agencies or a federal government agency, such as the Centers for Disease Control and Prevention. School nurses are employed by school districts and private schools to help students stay healthy and thrive academically. School nurses might provide preventative care to students, such as vaccinations, administer student medications, or provide health education to students. School nurses also provide medical care when needed for special education students and for students with complex health needs, such as those who use a ventilator to breathe. They also help care for students who have behavioral problems or chronic medical conditions such as diabetes, food allergies, asthma, and epilepsy. They provide this care while the school is in session. Occupational health nurses help keep workers healthy and help prevent injuries and illnesses at the workplace. They usually work for companies that have hazardous work sites, such as manufacturing companies, construction companies, nuclear power plants, and public utilities. Occupational health nurses might independently evaluate and treat workers, coordinate the care and rehabilitation of workers, or monitor and assess workplace safety. Some of these nurses advise company leaders on workplace health and safety. Occupational health nurses need to understand topics relevant to hazardous workplaces, such as toxicology, which is the study of toxic substances, and epidemiology, which is the study of how diseases spread. Some occupational health nurses work for government agencies, such as the Occupational Safety and Health Administration. Nurses perform a range of procedures to manage and treat injuries and illnesses. The types of invasive procedures they do depend on their training. Nurses often inject patients with medications, vaccinations, and other therapies. They also set up intravenous or IV lines to deliver medications, blood products, or other treatments directly to the patient's vein through a thin tube called a catheter. Nurses might also insert catheters elsewhere in the body. The Foley catheter, for example, is inserted into the urinary tract to drain urine. Nurses also clean and bandage wounds, and some nurses can suture or stitch cuts on the skin. Some nurses provide airway management by inserting a breathing tube. Some nurses insert nasogastric tubes that run from the nose to the stomach. Nasogastric tubes are used to deliver food and liquids to the stomach or to pump substances out of the stomach. Before a medication reaches a patient in a hospital or other institution, it must be ordered, and the prescription information must be transcribed and verified. The medication is then dispensed and delivered to the patient. Next, the medication is administered to the patient, usually by a nurse, and the patient's response to the medication is monitored and recorded. To make sure medication is given safely, nurses use a checklist called the 5 rights of medication administration. The 5 rights are right patient, right drug, right time, right dose, and right route. The right dose includes factors such as the amount of the medication and the speed of any intravenous infusion. Examples of routes for medication administration are oral, rectal, and intravenous. Researchers have found that many errors begin early in the medication administration process when the drug is ordered. The healthcare provider who prescribes the medication might be overworked and distracted, or the provider might be unaware of a patient's allergies to a medication or interactions between medications. The prescription might be incomplete or illegible. Medications with similar names are often mixed up as well. A number of errors can occur during medication administration itself. The administration of IV medications is especially error-prone. For example, sometimes nurses need to mix an IV drug with a diluting agent before they start it, and this can lead to contamination or errors in measurement. Other medication administration problems involve equipment failure, such as a defective infusion pump. Nurses can also be tired, distracted, or interrupted while giving medications. which increases the risk of administration errors. Fortunately, researchers have found ways to decrease the medication administration errors that nurses face. Hospitals can standardize medication labeling and pre-measure standard doses of medications. They can provide training in drug safety for nurses. Some hospitals provide worksheets to help nurses calculate the correct doses of medications. To prevent interruptions, other hospitals have used signs or given nurses special vests to wear when they are administering medications. Technological solutions include using barcoding technology on medication and using a computer program to report when medications are given late. Good documentation of patient care is vital because it makes it easier to provide consistent care across healthcare providers and shifts. Third-party payers also expect accurate documentation in order to reimburse healthcare providers for the cost of care. Furthermore, the patient record is an important legal document. Every step of the nursing process needs to be documented and updated as needed in a timely way for each patient. The nurse needs to record the patient's symptoms and the nurse's observations, and any new symptoms or problems that occur while the nurse cares for the patient. The nurse needs to record how the patient responds to medications and other treatments. If the patient is hospitalized, the nurse needs to record any information received from the patient's primary care provider and note any time the provider sees the patient or reviews the patient's chart. The nurse should also record the details of any consultation about the patient. The nurse also needs to record what he or she does for the patient. However, the nurse should not record what other healthcare providers do for the patient unless the nurse notes the name of the provider. Documentation in the patient's chart needs to be clear and thorough. Nurses need to make the patient chart easy to read, record data accurately, and mark errors or late entries appropriately. Nurses write down the date and time of each action they take for a patient, as well as the date and time they make the entry. For handwritten records, the nurse should write legibly in permanent black ink and sign every entry. If an entry is written late, the nurse should mark it as a late entry and record when the entry was written. So that others can read the chart accurately, the nurse should use approved abbreviations and symbols. Unless he or she is quoting someone, the nurse should not use slang. All entries should be objective, and the nurse should use details to support his or her interpretations. To prevent any unauthorized additions to the record, the nurse should draw a line through any blank lines or spaces. To correct the chart, the nurse should draw one line through an error, write the correct information, and date and initial the correction. Electronic medical records simplify charting in some ways, but researchers have found that nurses have three main frustrations with electronic documentation. Some systems are designed poorly, some systems are not integrated well with each other, and some systems create redundant documentation. Nurses use technology when providing direct patient care to protect patients from harm, to monitor patients, and to protect themselves from harm. Nurses also use technology to communicate, gain training in new skills, and manage staff and inventory. Examples of direct patient care technologies include feeding pumps, suction equipment, bar-coded medication, oxygen tanks and regulators, and automated leg compression devices. An example of technology used to protect nurses is the mechanical lift, used to move patients from bed to chair to toilet. More recent technologies that some nurses use include radio frequency identification tags, or RFIDs, video conferencing technology, communication devices such as pagers, and electronic health records. Some of the technologies that nurses use are poorly designed. Examples of design problems that researchers have found with hospital technologies include ergonomic flaws and poor interfaces between the technology and the patient. Other potential problems with healthcare technology are poor implementation, poor integration into existing systems, and poor maintenance. It is important that nurses should be involved in selecting new technologies and equipment, looking at factors such as ergonomics, safety, and usability. New technology should be implemented in stages so that nurses can get used to it. They should be trained in how to use the technology and evaluated on how they learn it. Once the technology or equipment is in use, nurses can monitor it for problems. They can also conduct risk modeling to predict how to respond to potential equipment failure. Nurses should provide feedback on how well the technology or equipment works with patients. This concludes Lecture C of Nursing Care Processes. In summary, nurses work in a wide variety of settings, from emergency rooms to patient homes. Within those workplaces, they have a wide range of responsibilities. Depending on their training, nurses perform invasive procedures such as giving injections, placing catheters, and suturing cuts. Regardless of where they work, all nurses must give medication safely, document the nursing process carefully, and learn to use technology. This also concludes Nursing Care Processes. In summary, the first lecture discussed that there are 3 types of nurses: licensed practical nurses, registered nurses, and advanced practice nurses. The 4 types of advanced practice nurses are certified registered nurse anesthetists, certified nurse midwives, nurse practitioners, and clinical nurse specialists. Nursing roles include direct patient care, teaching, research, and administration. Specialization lets nurses gain expertise in certain areas of healthcare. All nurses must have formal training, pass a national exam, and meet state requirements. Nurses stay licensed and build their careers by pursuing continuing education, certification, and advanced degrees. The second lecture discussed that nurses use clinical judgment skills when following the 5-step nursing process. Those 5 steps are to assess the patient, diagnose the problem, create a plan of care, implement the plan, and evaluate the plan. Nurses can also play important roles in protecting patients' legal rights and improving the quality of patient care. The third lecture discussed that nurses work in a wide variety of settings, from emergency rooms to patient homes. Within those workplaces, they have a wide range of responsibilities. Depending on their training, nurses perform invasive procedures, such as giving injections, placing catheters, and suturing cuts. Regardless of where they work, all nurses must give medication safely, document the nursing process carefully, and learn to use technology.